I'd say over the last couple of years, health systems researchers have recognized that we need to be more coordinated and intentional around how we generate research and what we generate it for. Institutions like Health Systems Global are helping with that coordination and providing forums for that. But at the same time, there's also recognized need for strong evidence for health system strengthening, evidence that shows that health system strengthening does have a positive impact. So I think those two things together, the timing is really good for right now for making those things happen, hence the Thematic Working Group.
There is a wealth of evidence that's available on what works in health systems strengthening. And the need is to translate this evidence so that it's accessible to the policymakers and managers and civil society groups and others inside countries so that they can act on that information. It's trapped inside very well-written, high-quality, peer-reviewed journal articles and other kinds of technical reports, and we need to get it into a form and in a timely manner to these audiences at the country level.
This challenge of making sure that the research we generate as health systems researchers does get used, and how early in the process we need to do that. I think that that's one of the sort of failures I think we have. We fail to engage our end users early enough.
So to address this need, a group of us established a thematic working group called Evidence to Action. It is one of 12 thematic working groups associated with Health Systems Global, and the purpose of our group is to bring together the health systems researchers and the users of that type of information to promote translating evidence into action.
I think the objective is to get people, researchers in particular, but also policymakers and implementers together to make sure that our research is asking timely, relevant questions, that it takes into account the context. It's not just a standalone piece of research, it takes into account context, where health systems are, and it involves the potential users of the research from the beginning so that we're giving them what they need to implement programs or make policies.
The Thematic Working Group focuses on the translation of evidence into action through sharing best practices, lessons learned, and practical guidance and tools.
Our Thematic Working Group is a community of health systems researchers and users of that research. We have members from all over the world, from India, from Lebanon, from Nigeria, and they're a mix of true experts and people that are just interested in elevating their own skills at translating evidence to action. So whether you're an expert or whether you're wanting to just learn to do this better, we really would welcome your participation.
If you'd like to join our Thematic Working Group, we'd love to have you participate. Start by visiting our webpage on the Health System Global website, submit stories, best practices, and other case studies, and participate in our webinars, either by suggesting topics and speakers or simply by tuning in.